Today, I am going to be interviewing Kim Vopni, known as the Vagina Coach. What a wonderful discussion we are going to have about pelvic floor health, bone health, and how important it is that you take care of your pelvis, not just for your bones, not just to look good because poor posture is not great, but you're going to learn how the pelvis is the foundation of everything when it comes to healthy, happy aging. Kim Vopni, also known as the Vagina Coach. Welcome, Kim.
Thank you. Nice to be here with you.
Yeah, it's nice to say that word because we all have one. And I don't know why my whole life I was so intimidated to say that word.
Yeah, we had to hush hush. We had to code name it, and I've had to code name it for a long time on social media because it's inappropriate on social media. That's changing a little bit, but yeah, it's a body part, just like our nose.
Yeah, just like our nose. And the thing is, Kim, is that what you do, you're a pelvic floor specialist. And the thing is that becomes even taboo. And so you have all these women suffering silently because they don't feel like they can talk about that part. So even just to call yourself the Vagina Coach and to bring this out and to soften up the word and for us to use that will now open the doors for us to talk about pelvic floor health.
Yeah, and that I didn't realize it at the time. It was a kind of an accidental selection of the word vagina coach because I was speaking at a conference and it was a business conference for women entrepreneurs. And I was providing a talk that was titled How Optimizing Your Pelvic Floor Can Make You a Better Mompreneur, because it was the Mompreneur Conference. And all of the speakers were business coach, strategy, marketing, like something to do with business. And so I came up and I joked as I was introducing myself and I said, and now you have a vagina coach for your business. And it was just like, that was the light bulb moment that I needed. I had been looking for a bit of a rebrand. I'd been formerly known as the fitness doula because I worked primarily with pregnant women and new moms. And then, so that just kind of was a light bulb moment. And part of, after I was digesting afterwards saying, I think I really should go for this, part of it was because vagina is one of the most hated words. Nobody likes to say it. Everybody hush hushes it. Everybody uses slang terms, which is not great for our children either. So I just said, all right, I'm going to step into this really uncomfortable spot and I'm going to say it. And people are going to remember that. If you say that word and then people kind of, did I just hear you correctly? But they're going to remember. I don't even need business cards anymore because everybody remembers Vagina Coach.
Yeah, I think I told you, you interviewed me on your podcast. I think I told you that my mom called it the fluffy maluffy.
Yeah. Yes.
With an accent. So for you,
Yeah.
it would be fluffy maluffy, but my mom's Scottish, so fluffy maluffy.
Yeah.
But anyway, so let's
That's
talk about the vagina or really the pelvic floor.
Yeah.
Let's explain why we need to raise our awareness and educate ourselves about the pelvic floor.
The pelvic floor is this part of the body that we receive no education about. We don't even know we have this. We've never been told this term pelvic floor. We see our external genitalia, but we don't understand the inner workings. Some people don't even necessarily know the difference between a vagina and a vulva. Hopefully most people know that there's a uterus, but that we don't really think of how they are all organized, where they sit, what they're supposed to do. So the pelvic floor is a group of muscles that closes off the base of our pelvis. And in our pelvis, we have bony scaffolding. So from a bone specialist like you're going to appreciate the bony scaffolding part. Mm-hmm. So here's our bony pelvis. We have our hip bones. This is the pubic joint at the front. A lot of people refer to that as the pubic bone, but it is actually a joint. That's an attachment point for the pelvic floor muscles. If I turn the person around, now we have the base of our spine. We have our sacrum. It comes down into our coccyx or our tailbone. That's also an attachment point for the pelvic floor. And then if this person was lying down on their back, or if they were sitting and we lift up and pry the flesh of our butt cheek away, we feel little bony points in our butt called our ischial tuberosities or our sits bones. So those 4 points make up the kind of the diamond shape where that group of muscles all attach. It's 3 different layers. It's not just one muscle. The first layer is primarily responsible for sexual response. Second layer, primarily responsible for managing the openings of the urethra, the vagina, the anus. Third layer, primarily responsible for our internal organs. So here is the bladder, the vagina, the uterus, and then we have the rectum. And this is sort of how they sit nestled within our pelvis. Those are the three openings. And the functions of the pelvic floor, I just pointed out the attachment points at the base of the spine and in the pelvis. So it plays a role in our pelvic and spinal control and stability. It's the foundation of our core. It also plays a role in, I said, sexual response, organ support, a sump pump action. So we have the pelvic floor and our diaphragm. And every time we breathe, ideally, if we're in optimal alignment and posture, the pelvic floor lengthens on the inhale and contracts and lifts on the exhale. And so there's this sort of synergistic dance that happens with all of our breath throughout the day that acts like a sump pump and helps move things in our body. So these are really important jobs that the pelvic floor has, but we've never heard about them. And it's usually only once there is a problem with one aspect of our pelvic floor that we then learn about all these things and we say, well, why didn't anybody tell us this before? There's so much that could have been prevented, and we have this anger and resentment about it. So it's so central to so many things that we do. And when it's working optimally, we don't think about it, and we shouldn't have to think about it. But when something's not working optimally, it all of a sudden becomes one of the only things we think about because it interferes with sex and exercise and social outings, how we plan our day, if we're fully present in all of the activities that we do in life. So that's, I consider it one of the most important parts of the body.
So I wanted to say, as you were saying, that's so interesting. There's so much parallel between what I do and what you do. Women find out at 60 or 65 typically that they have osteoporosis, and they wish they would have known. It's not something they pay attention to. So the pelvic floor, what I learned in these last few years, because it is muscular, as we age and we lose muscle tone, if we don't work out correctly or enough, or often enough, then we have sarcopenia, like a degeneration of muscles. The pelvic floor is a muscle. Who the heck wants the bottom of your body to fall out, like your foundation of your torso?
Yeah,
So
exactly.
we need to think about this. Even if you're not leaking and you're not having all the things that, I think bring a lot of women to you, even if you don't have those issues, your base. And so that's going to be the integrity of the structure and the alignment in your body. You're not going to be able to hold yourself up anymore, which is a really scary thought.
Yeah, yeah. And it's if anything, it's how we transfer load. And so you mentioned holding ourselves up. Part of how we hold ourselves up is because of our pelvic floor and how it works as part of our whole core stabilization system. But nobody's ever told us that the pelvic floor is part of the core. And a lot of times over many, many years, we have created, maybe with behaviors or certain movement patterns or breath strategies, we have hindered the pelvic floor. We've maybe even damaged the pelvic floor with constant pressure downwards, constipation, chronic coughing, chronic heavy lifting with poor form, poor posture. All of those can also contribute to pelvic floor challenges. And then what happens is people stop exercising because they're leaking, because they're afraid there's not going to be a bathroom close by, because they have prolapse. Some people have even been told to stop exercising. Don't lift anything over X number of pounds. Don't do any impact activity. And the intention is to protect the pelvic floor, but all we're doing is increasing that person's risk of falling, increasing that person's risk of sorry, I just lost my train of thought, but increasing the risk of osteoporosis, right? Bone loss. If they're not doing impact, if they're not doing resistance training, then how is that a good trade-off, right? So sarcopenia definitely influences the pelvic floor. Bone loss definitely influences the pelvic floor. Incontinence and pelvic organ prolapse are independent risk factors for hip fracture. And part of that can be, again, from the frailty and the loss of tone. Some can be because people wake up multiple times a night to pee, and in the dark they stumble, they fall. There's lots of correlations that we can find in there, but we have to pay attention.
Yeah, and then the correlations now again with what you're saying is that if you have these issues, then you stop doing things. Same thing with osteoporosis or osteopenia. When someone gets that diagnosis, they move away from movement, which is what we need to actually keep everything strong and mobile. If you fall and fracture your wrist, now you're going to baby the wrist and not work on it the way that you need to get it strong again to keep that range of motion in your joint so it doesn't break if you slip, trip, or fall and you need to brace your fall.
Yep.
So there's so much correlation here. And, you and I were speaking off camera about this. It's not really about not doing things or that's what happens is people stop doing things. And we have to do things, but we have to learn how to do them correctly. And this is where you need to be guided properly. One thing about what you were saying with heavy lifting, I think in the bone health world, we're realizing this intricate relationship of muscle and bone, which is probably why you're giving the statistics of sarcopenia, muscular degeneration of the pelvic floor is going to lead to less need for the muscles, the bones around it, your pelvis and your hips, and then right above your spine to be as strong as they need to be if you have less muscles to support, right? So, and then if you're going to do heavy lifting or I do mostly yoga and really deep bend or longer holds. If you're correctly loading into your hip joint with a deep bend, you need to learn how to do that and not be scared to do that. So this is hopefully, this will be giving women the understanding that learn what you need to learn so you could do what you need to do to keep your muscles, your bones strong, your pelvic floor healthy.
Yeah, and one thing that you and I are very aligned on, and I use that word align purposefully here. There's a lot of messages in the menopause influencer space, which thankfully there's way more conversation about menopause, but there's a very heavy, I'll use that term intentionally again, persistence of lift heavy, do impact. And so everybody's wearing weighted vests now. And I agree, we need impact, we need resistance training. However, we have to get ourselves there. We have to learn the skill of resistance training. We have to train the pelvic floor to manage loads of impact, progressively overload it. And we need to do so with what I call ABCs. A for alignment, B for breath, which is the core breath, which is essentially like a Kegel exercise, and coordinate that into movement and then progressively load it. If we take somebody who has non-optimal posture, and pretty much I'd say 98% of the people that I work with have poor posture and alignment, and we put a weighted vest on them or they start lifting heavy, that could be disastrous for the pelvic floor. And so then they're going to think, well, the heavy lifting ruined my pelvic floor. And we just need to kind of take a step back over here, learn this technique, understand what the pelvic floor is, how to work with it, how it coordinates with the breath, layer that into movement. And then the more you do that, it's like anything. We have to have a stimulus for the body to adapt to get stronger. And the more we impart that stimulus, the easier something is going to become. But if we stop moving, if we don't have a stimulus, if we don't use heavier loads, there's no reason for that adaptation to happen. And then one day they might go and say, oh, well, I'm supposed to lift heavy because I'm post-menopause and I have osteoporosis. But if they haven't learned that skill and strategy and how to and have built up capacity in their pelvic floor, then we could be facing some issues.
We are. I just had somebody reach out to me on Instagram to tell me her mother went to one of these facilities that's doing this, pressure, this intense workout, and she broke 2 vertebrae in her workout because the person working with her malaligned her and then created that compressive force. And so what you're speaking about, the foundation, right? If you're building a 10-story building and first floor is really not a strong foundation, then when you build on top of that, that's what's going to happen.
Yep.
I get asked all the time, what do you think of weighted vests? And here's what I would want to say about the weighted vests is, well, first of all, I don't think we need very many contraptions to take care of ourselves. So I'm of the belief that we can do what we need to do with our body. And if we're working out to learn it correctly. But with the weighted vest, you're right. Most of the women that I work with, I've seen thousands of people since I started teaching yoga in 2010. And thousands of people, very rarely does somebody have a nice postural alignment. They haven't been focusing on that. And if you're not aligned properly and then you put weight on that, it's the front part of the spine that fractures. Even if you feel it in your back, it's the front. That's where the spongy bone is. And those weighted vests, if you're already forward, that's just going to contribute. So I cringe when women ask me about a vest or I see people promoting those weighted vests. And I'm like, no, because you have to watch the women move and work. And then if you add rotational force, you're out of alignment, you're flexing your spine. It doesn't matter if it's a lot or a little. And then if you do a rotational force right there at that thoracolumbar joint, that's where most of the spinal fractures are. Ay, ay, ay.
Yeah. And when you think of, I've learned a lot. I would say perimenopause, I learned more about myself and my body than I had ever learned at any point in my life. And part of that was from my own curiosity and learning because I couldn't understand, excuse my language, what this shitstorm was that I was going through. I didn't know the term perimenopause. I had no idea what was happening. And I think of how much I have learned in the last, so I'm 53 now. So in the last like 13 to 15 years, that's a whole extra like 30 plus years really that I didn't really know a lot. And we deserve more information about our bodies way earlier in life. And I feel like that could change the world. And of course, I'm speaking because my bias is the pelvic floor. But if we planted the seed earlier about the importance of this group of muscles, all that it does, and because we are women who menstruate, many of us become pregnant at some point in our life and give birth. All of us who reach midlife are going to go through menopause. Those are additional risk factors for us that we need to consider. And we aren't just small men, as Dr. Stacy Sims has coined that term. We need to understand our physiology and how it's different from men. And we need to nourish differently. We need to move differently. We need to appreciate the menstrual cycle and all of the changes that happen and how that influences this central part of our body where that's where we generate our power. And so when we think of lifting, part of our capacity to lift is from our pelvic floor, is from that core activation. And if all we've ever learned was crunches and do some spinal extensions for your core, we're missing a whole heck of a lot that could really benefit us.
Yeah. Do you know if the pelvic floor is considered part of the hip complex? That
There are muscles within the pelvic floor that some argue are pelvic floor muscles, some argue are hip muscles. So yes.
Okay. Because what's really interesting, so the pelvis, the largest bony structure in the body, and there's not a lot of muscles. There's the muscles below the pelvic floor. There's the muscles that attach the legs, that move the legs. And then above are those core trunk muscles that are around it, right? So this largest bony structure in our body that is the center of our body, that is the fulcrum. If we were teeter-totters, that is the triangle box that we teeter-totter over. So we have this bony structure, large, heavy bony structure with not a lot of musculature to mobilize it, to stabilize it, which is why, and I honestly, I just realized this. I mean, I knew some of these things, but you're getting me to understand this even more because you and I are so into the need for postural awareness. And so it is that base that does so much to make sure the largest bony structure is where it needs to be so that everything above, the spine, all the upper body muscles, and more importantly, the 10-pound head that we're all balancing all day long, that we manage this with these muscles here.
Yeah.
And yeah, so gosh, then if women are leaking and are having incontinence issues or whatever, waking up with them, all of the stuff that we're doing, it makes sense that like, gosh, we're going to not be working on this part that is so important. We need to raise this awareness, and you're doing it. So thank you so much.
Yeah, you're welcome. And part of like, as you're talking, I'll get my model out here again. This is what would be considered optimal pelvic alignment. So we have our sits bones and our vulva. Like if we were sitting, we would be sitting on our sits bones and our vulva. And I don't have a full spine here, but there is the gentle curve in the low back in our lumbar spine there. The front part of the pelvis, the pubic joint, that becomes a shelf for our bladder. So we have bony scaffolding support here for the bladder when we are in an optimal neutral pelvis or optimal alignment. When people leak, when people have strong urges to pee, when people experience pelvic organ prolapse and feel vulnerable, like they feel something's going to fall out, they guard. And by guarding, what happens is they will squeeze and kind of tuck their pelvis, almost like tucking their tail underneath them. And this is the position that many people will sit in or stand in. So I've now lost the bony support for the bladder. The uterus rests on top of that. More strain is on the muscles and the ligaments. And the adaptations that happen in the pelvic floor musculature and the hips is shortening and tightening. So we have less blood flow, less circulation. Tight muscles are not strong. Tight muscles are weak. They will be hindered in their reaction time. They will be hindered in their ability to generate enough force to close off openings or support the organs. So the alignment and our posture, we have to start there, because if we are constantly tucking and gripping, then we're not managing pressure well. We're putting more downward pressure on that group, and the whole, as you say, hip complex and pelvis, the girdle will become compromised. So that has to start first. The alignment has to start first, and then we can start to layer in the breath. Then we can start to coordinate it into movement. Then we can start progressively loading and adding resistance training and adding impact. But we need the foundation or the fundamentals in place first.
Yes, and if alignment, the tight muscles being weaker, well, you're making me think of the hip, which is what I spent a lot of time educating about. We need our hips to be responsive, to be strong. Like for me, it's not just about stronger muscles. Low body muscles, a lot of the research shows is that lower body muscles equals healthier aging, right? Less risk of falling, more movement is going to incur. But also, we want to minimize a hip fracture.
Yeah.
And so you need limber muscles. And so you're saying tight muscles are weaker. Tight muscles are also less receptive to the forces that come into our body if we slip, trip, stumble, or fall,
Yep.
which we do because we have diminishing capacity of eyesight and whatever. I fall way more now in my 50s than I ever have. And it's really interesting because a lot of my students will come up to me and tell me about falls that they've had. Just recently, someone said she was on her bike, a car pulled out in front of her. She could either run into that car or go to the side and fall. And she fell. And she said, it was such a big fall and I didn't break anything. She goes, and I'm shocked. She said, but I honestly think the yoga that I'm practicing, the limber aspects of her joint responded.
Yeah.
So yes, it's like I'm thinking about the flexibility part right now, the strength, the flexibility, that range of motion.
Yeah.
It's all so important, Kim, that we learn these tools and habits and techniques, how to do them safely
Yeah.
to prevent fractures, to keep our body, our bones strong as we age.
There's also an interesting link between walking speed and pelvic floor challenges. And when you think about, as you're talking, the shorter, tighter muscles, we lose our quick reaction time. When we don't have as much mobility, we can't take as big of a stride. So, and people who then are now maybe even afraid of falling are going to be hesitant in how much they walk. They might become more of a shuffler. If they have been inactive, their body is going to kind of adapt to the shape of a chair. They're not going to be loading through their joints. So they're going to be off balance, and they're not going to be walking as fast. And that's also a contributing factor to incontinence. So like, it's just, we can look at so many little things that we never even really think about, and then always come back to, well, you and I will say the bones, the spine, and our hips and our pelvic floor.
Yeah, it's so true. Just listening to you there, I do a lot of gait training with people. And what I noticed, I fell over a year ago. And as I was falling, I was so conscious of it. I was subconsciously or consciously trying to pull my leg to elongate my stride to stop myself from falling. You're making me think that that's probably what's happening for these people that are telling me they fell or they should have fallen or they didn't fall as bad, or what they say is their very present moment in the fall. So even there must be some brain pelvic floor muscular connectivity when you some raised awareness or some light bulbs going off, or maybe just bringing a lot more response
Yeah.
into the body when you focus on all of this. Wow, I'm learning stuff.
Yeah.
Or just putting these pieces of the puzzle, like, wow, how
Yeah.
could we not focus on the pelvic alignment for
Yeah.
all of these things?
Yeah. Yeah. And the other piece that I love bringing in is power. So we have people think of pelvic floor muscle training as Kegel exercises. And Kegels, we have evidence to show that they work when they're done correctly, when they're done consistently. But the limiting factor in Kegels is usually they're done lying down on your back, sitting at every red light while you brush your teeth. That's how we've been told that we should do Kegels, right? So people are like, okay, I'll do my 3.5 Kegels while the light is red. That's not enough stimulus for any adaptation to happen. Yeah, you might get a little blood flow going, but that's not going to make any meaningful change. And it's not going to translate to when you are leaking at the gym or pushing a heavy door open, or leak or feel vulnerable when you stand up from a chair. So we need to train the pelvic floor dynamically with movement. And we need to train for power because, like the rest of our body, we have type 1 and type 2 muscle fibers. So the type 1s are sort of like the endurance, type 2 are the sprinters. Those sprinter fibers, we lose more of them. We lose them more rapidly, especially post-menopause. We lose our capacity for power, so that quick reaction time, as you're talking about. And unless we train for power, where we have more explosive movements that can also be part of maybe impact training, then we are again compromising our capacity to manage things that happen in life. So pelvic floor muscle training is so much more than Kegel exercises. And I don't want people to be like, oh my God, now I have to spend 5 hours a day doing my pelvic floor muscle training. We can incorporate our pelvic floor muscle training, as I told you, as part of the core. We incorporate it into whatever other workouts we're doing, yoga with you or resistance training at the gym. Once we have that awareness of our posture, that alignment, the core breath, coordinating into movement, that is how we also train our pelvic floor. But we just have to get there in kind of stages. And then it takes 10 or 15 minutes a day.
Yeah, and 10 or 15 minutes a day to preserve your power, your freedom, your quality of life for fall prevention, fracture prevention. And if you have the incontinence, I think that's a little bit more immediate, that you don't want to leak, right? There's that. With osteoporosis or osteopenia, the fear of fracture is there. And so it's what's 10 or 15 minutes. And this is a lifestyle. If you don't take care of you, who else is going to?
Yeah. And who's interested in suffering? Not me. I have suffered with some pelvic floor dysfunction. I have witnessed my mom suffer for years, and I am doing everything. I'm fighting. I'm raging against the machine to fight against that, because I'm not interested in suffering, and I will not accept it. So I will do everything that I can and invest that 10 to 15 minutes. There's a lot of other things. Like, we have to look at lifestyle. We have to look at behaviors that we have. What are we eating? What are we drinking? What are other things that could be contributing to our challenges? Hormone therapy. There's more than just pelvic floor muscle training. But it's all, at the end of the day, helping us increase our lifespan, helping us increase our health span, helping with our longevity, and reducing suffering. That's a big goal of mine.
Yeah, it's hard to send prevention to cell prevention.
Oh, yeah.
And I myself at 50 had a collapsed hip joint, total hip replacement at 51. So I feel like I kind of ran ahead and experienced how hard it is to be non-weight bearing. And it's really, really hard to cell prevention. So one thing I always say is, you don't want anyone else wiping your tushy, do you?
Yeah. Yeah. It's a true story. When I first started doing this work, it was with pregnant women. And my intention was to help educate them about pelvic floor and train for birth, train for childbirth, and set them up for a better postpartum recovery. And the most common customer I had was the second or third time mom. The first time moms are like, I'm fine. I'll be fine. I don't need that. And then the second, they're like, I really wish that I'd paid attention to you. I really wish that I'd done this. I wish I'd done that. And now most of the people that I work with are in that perimenopause, menopause phase of life, where many of them have been suffering for 5, 10, 20 plus years. And then it gets to the point where they can't take it anymore and they have to do something, or they've had failed surgeries along the way or whatever. And now they are more motivated because they have a problem to overcome. And while it is never too late, I am definitely on the side of, let's stop it from happening in the first place if we can. And that's also if it does happen, we still are going to be stronger as a result because of this work that we've been doing.
Right, and that we have this experience, you and I, of what we've observed over the years. I mean, those mesh surgeries are terrible if you have to get that taken out. A mesh that's inside the body that's developed scar tissue. I've worked with women privately that have had mesh issues. Probably, if I didn't know you then, I should have sent them to you. But yeah, so it's like we know, we're speaking from trying to help you not arrive at this place, because we know what it's like and we know what the suffering is like from that perspective.
Yeah.
And there is this intricate relationship of and 10 minutes a day, for you doing the pelvic floor, getting that whole structure starting at the bottom. For me, I would say also, yeah, I focus a lot on the hip. I mean, that's a big part of it. And of 10 minutes, 15 minutes a day can be enough if you're creating and demanding as much as you can, not, We have to definitely, I'm not saying going big, but what Dr. Bush, this orthopedic surgeon that I partner with, what he told me or really raised my awareness to is that muscles are present moment and they're judgmental. So every single moment, they are, what do I need to do now? What is she asking for now? What do I need to do now? And they're so judgmental and present moment. And the judgmental is what we're speaking about with the alignment. And if you are aligned, not just pelvic floor, but going all the way up the spine from the plumb line of the crown of the head to where pressure is pressing down on us. If you are aligned, this is the premises around some of these companies that have machines that they're saying can create enough force in 10 minutes. That osteogenic loading is the word. It's not their word, it's the word on proper joint. If your joints are properly aligned, the osteogenic loading that takes place in a perfectly aligned postural position can then create the right forces to keep the bones strong for the rest of your life.
Yeah.
So this is what we're speaking about, not that you're going to a facility that has that, but osteogenic loading is not is posture. It's aligned posture, putting the right forces. Starting from the head. I mean, we're speaking pelvic floor with you, but above the pelvic floor, because the sacrum and tailbone are embedded in the pelvis, where the pelvis goes, the spine follows, right? And so it's if you have that anterior tilt or that posterior tilt, you're then going to go into lumbar, up into thoracic, and into cervical, and then where's your head? So it really does matter. I mean, to me, it's the most important thing I teach is posture, alignment, and the awareness of these components.
Yeah. There was a study, there's a few studies, and I was just looking at them recently, and there was a kind of a compilation of them looking at, they called it, I think the terminology was abnormal spinal curvature, but basically they were saying loss of lumbar lordosis and excessive kyphosis were contributing factors to pelvic floor dysfunction, most often pelvic organ prolapse. So, and as you were talking, I was thinking to one of my teachers, Katie Bowman, who she's uses biomechanics, and she uses stick figures and looks at geometry and physics and makes it very easy to understand loading. And that was one of the big ahas I had when I was learning from her. She's at Nutritious Movement, and it's about that. She didn't use the term osteogenic loading, but as you're talking, that's exactly what her imaging was, is without proper loading through the bones, we are getting more degeneration. And that's what's contributing to the kyphosis, to the tucked under pelvis, the loss of lumbar lordosis. And so we have to, first of all, we need that awareness. And it's just not taught anywhere.
It's not. And astronauts, when they go into space and they do not have gravitational force pressing down to give them that osteogenic loading, they develop osteoporosis.
Yeah, so interesting.
Tough, strong 30-year-old guys with lots of muscle mass on their body without that pressure. And so we have gravity here. So now if we have alignment, I mean, even in and of itself, Kim, the work you do, the work I do, to keep that hip complex strong, the spine strong, perfect alignment is going to be what you need. So let's talk about how we need the muscle part of that. It's not just, oh, here I am, I'm sitting up straight.
Right.
Because I teach a chair class. I teach 5 classes a week, but I teach this chair class. And I got the beginning of class. I said, okay, let's find perfect posture. Brought them away from the back of the chair so they're not leaning. Had their elbows under their shoulders, because that means that you're going to have that shoulder joint in the right place. Palms up on their thighs for external rotation to take the shoulder. And then push your shoulders away from your ears, slide your shoulder blades towards each other. You can't last for very long before feeling the burning of your postural muscles in the back of your body, right? The rhomboids, the traps, activating those levator or erector muscle groups of your spine. Mm-hmm. So talk about that part. Like you said, 10 to 15 minutes a day. So what is it that we're focusing on? And before you go on, I'm going to share all of the information below because you've got great programming, the Buff Muff method, the challenge, your community and all that. And so that hopefully everybody joins. And so just give us a little bit of the, like, what is the 10 to 15 minutes?
Mm-hmm. So the first of all, understanding that they have a lesson in posture. And what I say in that is exactly as you just said. It's not about, okay, put my shoulders back, okay, and do all right, I'm lined up, I've got my plumb line, okay, and now I have to stay like this all day. That's not what we're saying. But we have to look at what are the things that are contributing to the fact that we may be losing our lumbar lordosis or hyperkyphotic. And oftentimes it's tightness in the chest from everything we do in front of us, stretched, weak muscles in the back, tight hamstrings and calves, sometimes even from the footwear that we're wearing. So we have to look at, yes, I can give you cues to help you find better alignment. But once we're there, we have to understand what is it that's, when I say to somebody, I help them into optimal alignment, and then I say, okay, now relax. I usually film them and then just say, okay, now just let that go. And so often it's this sort of slump that happens where their pelvis goes forward, their upper back is leaning. It's so classic. Like it's almost 95% of people that do it. So then we look at lengthening the tight muscles, strengthening the long stretched muscles so that over time we come back to that balance naturally without having us to put ourselves in optimal alignment, if that makes sense. So all of my 10 to 15 minute workouts will start with some sort of a release. And that's often belly, hamstring, thoracic, so in and around our spine and our ribs, pelvic floor, glutes. Those are the most classic, I would say, and psoas. Then we do a couple of up training, up regulation, where we're adding the core breath. We're adding voluntary activation and relaxation of the pelvic floor to something like a bridge, a squat, a push-up. I do rotation for people that don't have osteoporosis, some sort of movement, bird dogs, anything really. They would do 3 of those, and then they would end also with another release. And anybody who comes into the program, sometimes people will message me and say, I actually feel worse. And usually those are the people that have tightness in their pelvic floor. So as I was mentioning, when we are guarding from leaking, when we're afraid of urgency, when we're feeling vulnerable from prolapse and we have that tucked position and we're getting more tension, the muscles are adapting to a short, tight state, we need to really work on the release work first. And then maybe only add voluntary activation every 3rd or 4th repetition until we start to get that balance again. And then we can go back to normal from there. But everything starts and ends with a release, a few activations. But just by adding the core breath, knowing the inhales are where we have expansion and lengthening of the pelvic floor, that in and of itself is part of the practice. It's letting the pelvic floor release and lengthen, because people are like, that feels unsafe to me. If I do that, I'm going to leak. If I do that, my uterus is going to fall out. That's the belief that we have. But once we can help them understand that when there is tightness, we don't have the support, we do have more symptoms, they can start to build up trust in their body and feel more confident in letting the breath help them.
Okay, I want to speak to that. But before I say that, you could twist with osteoporosis. So I know that the Mayo Clinic, you had a study that they followed, but if you are perfectly aligned, it's really that thoracolumbar joint. T8 through L2 is where all the fractures are. As long as you are not flexed forward, so if you find alignment and then you add rotation, really working on thoracic in particular, so you can.
Okay.
And of course, for somebody who maybe has compression fractures,
Yeah.
maybe they're more cautious, but as long as they're able to find that, and if you have calcifications in a kyphotic posture, you might not be able to get to a place where you are really open.
Yep.
But I think it's really important because the multifidi muscles that go through the spine, if we can get them pulling on all of those different directions, it's one of the best ways to create vertebral bone stimulation.
Okay.
Right, so in my training,
Yeah.
I'm safely twisting.
Okay. Good.
But what you were just saying, and this is where I think I'd like people or women to really think about this. You're either tight on one side, loose on the other. Tight down here, loose somewhere else. Because it's a lever and pulley system, your body is trying to not fall. So you're going to have one side that's tight, one side that's loose. And that in and of itself is uncomfortable. And that is going to lead to all the things we're talking about. So the 10 to 15 minutes of softening and loosening is almost to take the clay that's in a shape and to actually bring it back to center, to mush, to then redesign it back into optimal. And optimal is comfortable. Stacked joints can be comfortable.
Yeah. 1,000%. And it's also something that doesn't happen quickly, really. I mean, change can happen fairly quickly for certain things, but there is a lot of inputs that happened over many years and many life experiences that contributed to where you are right now. We can't expect that within a few days of doing a few stretches that we're magically going to have a completely different body or experience. So helping people with some patience and some grace for themselves, that it is a learning. Like when people first learn the core breath, 99% of them, this feels weird, it feels awkward, I'm doing it backwards, I don't like this, can't I just breathe the way that I used to? A lot of people think of inhaling and sucking up and then exhaling and letting go, which is reverse to what we would want to do. It's reverse to what physiologically happens. So it is important that we do it the way that I've prescribed it in there, but nobody initially likes it because it feels weird. So then we look at, well, why were you doing it this way? Was it because you were taught that way, which is where it's just like that's what you thought you were supposed to do? Is it the way that it felt that you could feel something in your body? Who knows? But, and it's not like, I don't want to, you're still breathing. Obviously, you're here, you're alive. You're still breathing. It's not that you were breathing incorrectly. It's just that a certain pattern you had was maybe disrupting what would be more optimal for you. So if we want somebody to change, we then have to change something. And we're going to change our breath. We're going to change posture. We're going to work on, as you say, take those pieces and try to get more balance so that that optimal neutral alignment is just where we are. It's not somewhere we have to put ourselves and then try to stay there.
Yeah, so the pelvic floor work is really getting me to understand more the foundational components. And, for me, I think of the spine and I think of the whole body, but you're really getting me to want to get more into starting here. And really, I think that that's a really great way to think of it, to think of the base of the structure.
Yeah, it, as you said, it literally is the foundation. It's the foundation of the core four: pelvic floor, diaphragm, transversus multifidus. There's our inner core unit. If the foundation of anything that you're building is not working optimally and not able to manage, then something is going to shift up above and have effects that we don't want.
Yeah, and because of our lifestyle, where everything is forward, you were mentioning that, because this 10-pound head of ours, I read that the head is on average 8 to 12 pounds.
Yes.
And my question is, how do we know?
Yeah.
How many heads have they measured without the bodies being attached? So I'm a little bit curious, and I always question everything. I'm like, wait,
Yes.
how do we know that? Anyway, let's say it's 8 to 10 pounds, and everything is forward: cooking, reading, texting, computering. Even when you sit on the toilet, you sit forward. And, this is really interesting. Before my hip replacement, when I had a collapsed hip joint, because I had a torn labrum that had surgery, and for 17 months I always say, I tried to put Humpty Dumpty back together again. But for 17 months, and I couldn't because the doctor took bone off my femur and off my acetabulum. So surgically, I was put into a place where I had a collapsed joint. But one thing I noticed is that when I would go to the bathroom and I would go to wipe myself at the end of what I believe to be the end of urination, it would dribble on my hands. I now think of that as the hip couldn't stay neutral. I was anteriorly tilted. And so it's so important that this part of our body is aligned. And especially because all day, every day, we're forward. Everything, cooking, everything.
Yep. And that could be like that post-void dribble could be from tight muscles. So it could be tight pelvic floor muscles, which if you think of having a hip injury, the pelvic floor is definitely on high alert and trying to help out. That when we sit down to urinate or poop, we need the pelvic floor to relax. If it's not relaxing, then we might strain to poo, we might be pushing to pee, or we might experience post-void dribble because the pelvic floor hasn't relaxed completely to allow the bladder to empty completely. It could also be a sign of pelvic organ prolapse, where in the form of, like, if you have your vagina here and here's your bladder, this is the front wall of the vagina, the bladder starts to bulge into the front wall of the vagina and creates a little bit of a pocket where urine can get trapped. And so when you get the urge to pee, you sit down, you void, but there's still that little residual that's been stuck in that little pocket. And then when you stand up, sometimes that will shift a little. So it could be that as well. I'm not saying this is you. I'm just saying that there's other contributing factors, and a lot of people deal with post-void dribble. So we have to look at, why do we have that? And seeing a pelvic floor physical therapist is hands down, if you were to take one thing away from this episode, would be go see a pelvic floor physical therapist. And for people who have had a hip replacement, who are scheduled for a hip replacement, and also do your research on what type of hip replacement, anterior, lateral, posterior, because there's different influences to the pelvic floor as well. So when you're talking about the hip, there's so many things to consider. And usually incontinence, sometimes people will find resolution for their incontinence after they have had their hip replacement. But again, it depends on the type that they've had.
Yeah, I mean, my hip replacement, I didn't have anymore. There's a name for it. Post what?
Post void dribble.
Oh my God. And we might be saving some for later if we're in the wrong position. It's like, oh my gosh. And I'm thinking about myself, my lack of patience, especially in the middle of the night, getting up to go to the bathroom and then squeezing and pushing as much out as quickly as possible
Yeah.
because you're in a rush. I know. Well, I'd like to end with one of the best gifts that not only have you given to me, well, you've given me many, but this is one of the top. And because you've passed this on to me, I have passed this on to hundreds of people since then. And it is that after 20 years in my 50s, I am no longer urinating in the middle of the night. And so I would love for you to I mean, seriously, Kim, it's amazing. Like, I think of you when I wake up at 6 a.m. and I'm like, oh my God, I didn't pee for 8 hours. I'm like, how did Kim do this? Like, it's like magical.
I'm waving the magic wand.
You did. And I've shared it. And so in my classes, like I have like 30 people in the class and I'm like, all right, ladies, here's what you're going to do. And I tell them the steps. And not only ladies, but men, I've told this to as well.
Yeah.
And then I check in the next class. All right, the homework. Who did their homework? Or they're emailing me or texting me and telling me that's been the case for them. So I think we're all just kind of like mouth open, like, what? For 20 years, I was peeing at night and I didn't need to. So can you share what you shared with me? Because I think it's fascinating.
Yeah, it's so often, and you brought up a good point too. Men also have a pelvic floor. So I want to highlight that male and female anatomy, we all have a pelvis, we all have a pelvic floor. Male anatomy, the pelvis is narrower, a little bit higher. They don't have a vagina, they don't have a uterus, they don't have a menstrual cycle. Like we have greater risk factors, but men can experience some of the same challenges that we do, waking at night, incontinence issues, and often it's prostate issues that sort of trigger the incontinence. Not always, but that's a major contributor for incontinence in men. Waking at night to pee is nocturia is the name, and it could be because of medications. It could be from sleep apnea. It could be from blood sugar dysregulation. It could be from training, which is kind of what was highlighted to you. Many people wake up in the night for some reason. Snoring partner, the temperature in the room's hot, there was a noise, stress, whatever. We wake up. And often if we wake up, especially if this has been happening and we're frustrated that we woke up, then we're like, damn it. And then get a sympathetic nervous response, get a little bit higher heart rate. That's going to then trigger the bladder to signal you that you need to go to the bathroom. And you think that you woke up because your bladder. So then you go to the bathroom and then you go back and you try to fall back asleep. And the more you respond to that and go to the bathroom, the more the bladder becomes trained. It's a muscle. It can be trained like Pavlov's dog. So it starts to learn. Debbie likes to go when it's only this full as opposed to this full. And so we'll signal you more frequently and you will then continue to go. But once you understand that you don't have to go, then you use the distraction technique. So things like pointing and flexing your toes. So lying in bed, if you wake up, don't immediately get out of bed and go. You lie there, you take some deep breaths, point and flex your feet. You can scrunch your toes. You could do a Kegel exercise, like a contraction while you squeeze your toes. Some people that might make it worse. Some people that makes it better. You can also use something like counting backwards, use literally a distraction technique, and wait for that signal to subside, and then you go back to sleep. It could also be poor hydration through the day. It could be bladder irritants throughout the day as well. So we want to highlight staying hydrated. You want to make sure you remove bladder irritants. Alcohol, caffeine are definitely going to make you need to go more. If you drink big volumes of liquid before you go to bed, of course, that is going to increase your need. But if you're staying hydrated in the day, tapering off your liquids about 2 hours before you go to sleep, you don't have bladder irritants, you can absolutely go the entire night without waking. If you do wake, also try to look at root causes. Why am I waking? And try to figure that part out as well. But don't go to the bathroom. Don't respond. You are in control, not your bladder.
Yeah, I have lots of bladder talk now. I've talked to my bladder. I'm like, oh, heck no. You do not need to go when it's only this full. And I learned in your course, the Buff Muff method, that there's about a cup and a half of liquid. So now when I go, I'm like, wait, was that a cup and a half? And in the last 2 months or whatever, since you've taught me this, if I wake up like at 4 or 5 and I give in, finally, I'm like, okay. And then it's like, see, it was only half a cup. So I am not going to do that again. I'm serious. I do this. So I have this bladder talk. And you know what else I've noticed, Kim? This is not just that now, because sleep is critical for bone health. Sleep is critical for brain health, for anti-Alzheimer's, for bone health, for lots of other things. But what I've noticed too is that I've retrained my bladder, not just at night, but during the day. So I am back to my bladder realizing, oh, heck no, I don't need to go when there's only half a cup in here. We still got another cup to go.
Yeah. Yeah. And how, like, it's life changing. It literally is. So many people are literally planning their life around the bathroom because they need something close by every 20 to 40 minutes. That is very intrusive into our quality of life. And so every 2.5 to 4 hours would be considered normal. Sometimes if you have an irritant, a bladder irritant, you might need to go more often. If you have a huge volume at one time, you might need to go more often. But it's something that sleep is so important. And if we are not getting good sleep, that's also going to contribute to more pelvic floor symptoms in the day as well. And one other thing I want to add on that is if you are close to or post-menopause, another what I consider to be essential component to help with nighttime waking, urgency through the day, frequency is local vaginal estrogen, bioidentical vaginal estrogen. I jokingly say it's an essential nutrient. It's not a nutrient, but I think it is something that is essential for all of us from a longevity and health perspective as well. And some people will say to me, oh, I don't have sex anymore. I don't need that. And it's vulvovaginal health, yes, is a part of your sexual wellness, but they don't have to, they are two separate things. And our vulvovaginal health is important regardless of whether we have sex or not, whether we have insertive sex or not, whether that's with a partner or not, it doesn't matter. So we need estrogen for building strength. If we are doing all of this work to try to build up our muscles in the absence of estrogen, it's going to be a lot harder. So estrogen will help us build up our muscles and make what we're doing more effective. It helps with urgency, it helps with frequency, and it helps reduce the risk of UTIs. That's one of the biggest ones. UTIs skyrocket post-menopause because of that low estrogen state. And UTIs can become life-threatening. It sounds very dramatic, but it absolutely can. And it's very, very preventable with vaginal estrogen.
Yeah, it is a big issue that God. So what I'm thinking when you're saying this, I mean, I'm listening to you, of course. It just seems like a power center. Even to say the word vulva, it's like my vulva. It's like such a powerful thing that we as females have. And it's such a powerful part of our body, whether we're talking pelvic floor, which is your specialty, the base of our foundation and structure. And then in my work, so much attention is paid to this part of our body for fall and fracture prevention, because these are the fractures that we die from.
Yeah.
Right. These are the ones that are uncomfortable, lower quality of life. But these are the ones that we die from. These are the ones that we lose our life over. Not just die as in 25% die from this, but you no longer are independent and can't even live or move or walk anymore. And that's where I was at age 50. And that's why I do what I do.
Yeah. And thank you for doing what you do.
Yeah, and thank you. So you have been huge for me in my life. Can't wait to share you with my community. Love what you're doing. And there's a lot you offer. It'll be in the show notes. You do have a vaginal cream, I believe, or an estrogen cream, or will.
In development. It's
in development.
Almost ready, yeah.
Okay, but you also recommend that, so whether it's yours or not. And then all of the stuff you do, the Buff Muff method and all of your things. So,
yeah.
Kim, thank you so much for coming and speaking with us today.
Thank you so much for having me. It was a great chat.
Thanks for joining me on Stronger Bones Lifestyle. Are you ready to take charge of your future? For show notes, resources, and information on my programs, please visit DebbieRobinson.com. If today's episode empowered you, be sure to subscribe, leave a review, and share it with someone who needs it. Together, we're building stronger bones and stronger lives. Take care, and I'll see you in the next episode.